Hello friends, my name is Sopan Gode and my topic is uterine stimulants. These are also known as oxytocics or abortifacients. This comes under the competency PH 1.41, which describes the mechanism of action, types, doses, side effects, indications and contraindications of uterine stimulants. The uterine stimulants or oxytocics includes posterior pituitary hormone, oxytocin, desaminoxytocin, ergot alkaloids like ergometrin, methyl ergometrin, prostaglandins like prostaglandin E2, prostaglandin F2 alpha, 15-methyl prostaglandin F2 alpha, and misoprostol. Also, some other miscellaneous drugs like ethacridine and quinine. Among these, let's first talk about the oxytocin. It is a non-apoptide secreted by the posterior pituitary, synthesized within the nerve cell bodies in the supraoptic and paraventricular nuclei of the hypothalamus, transported down the axon, stored in the nerve endings within the neurohypophysis, and released by the stimuli appropriate for oxytocin, that is coitus, parturition, and suckling. Now, let's talk about the actions of the oxytocin. The first is on the uterus. It increases the force and frequency of uterine contractions. The mechanism of action here is there are specific G protein coupled to oxytocin receptors on the myometrium which mediate the response mainly by depolarization of the muscle fibers and influx of the calcium ions as well as through the phosphoinositide hydrolysis and IP3 mediated intracellular release of calcium ions. Second is on the breast. It contracts the myoepithelium of the mammary alveoli and forces milk into the bigger milk sinusoids. Also, it mediates the milk ejection reflex initiated by the suckling so that milk may be easily sucked by the infant. The third is on the CVS. Its conventional doses have no effect on the blood pressure, but higher doses cause vasodilation, producing brief fall in the BP, reflex tachycardia, and flushing. The umbilical vessels are markedly constricted. Oxytocin may help in their closure at birth. Fourth is on the kidney. Conventional doses are without any effect, but in higher doses, it exerts ADH-like action. Urine output is decreased. Pulmonary edema can occur if large amounts of intravenous fluids and oxytocin are induced together. Now, let's talk about the physiological role of oxytocin. The first is the labor. Oxytocin is released during the labor and the uterus is highly sensitive to it at this time. However, it does not appear to be obligatory for initiating parturition. A facilitatory role is more plausible. Prostaglandins and platelet aggregating factor are complementary to oxytocin. Second is the milk ejection reflex. Suckling reflexly induces oxytocin release from the pituitary and it contracts the myoepithelial cells. Third is neurotransmission. Oxytocin appears to function as a peptide neurotransmitter of oxytocinergic neurons in the hypothalamus and brainstem, which serves to regulate autonomic outflow. Pharmacokinetics of oxytocin. Being a peptide, oxytocin is inactive orally and is generally administered by intramuscular or intravenous route, rarely by intranasal spray. It is rapidly degraded in the liver and kidney. Its plasma T-half is 6 to 12 minutes. This is further shortened at term. The uses of oxytocins include induction of labor, uterine inertia, postpartum hemorrhage and cesarean section, breast engorgement, and oxytocin challenge test. Now, at the end, let's talk about the adverse effects of oxytocin. Injudicious use of the oxytocin during the labor can produce too strong uterine contractions, forcing the presenting part through incompletely dilated birth canal, causing maternal and fetal soft tissue injury, rupture of uterus, fetal asphyxia, and death. Water intoxication. This occurs due to ADH-like action of large doses given along with intravenous fluids, especially in toxemia of pregnancy and renal insufficiency. It is a serious complication. So, this comes to the end of my topic. Thank you.